his recovery may take a long time, months to years, and it may not be complete. We know that the injury to Tiger's legs involves the upper and lower portions of the tibia, or his shin bone, the ankle, and his foot. That means his ankle joint, the essential joints of his foot, and possibly his knee may be affected. If these fractures involve the surfaces of those joints, meaning the cartilage and other tissues, those joints are at risk for deteriorating a little quicker than they otherwise would, meaning developing arthritis or getting stiff. And because these fractures are open, that means that the bone fragments came out of his skin and were exposed to the outside world, including bacteria. Open fractures have a higher rate of infection, and so urgent surgery to clean the affected area was necessary. I think the most striking part for me is that a surgical release was necessary, and that tells me this was an incredibly severe trauma. It means that Tiger was at risk for or developed what's called a compartment syndrome, a condition of extreme swelling. Tissues like muscles swell in response to an injury. The muscles are lined with a casing called fascia that's a little bit like a sausage. The swelling can't go anywhere, the pressure builds up, and it can get higher than the blood pressure, so blood can't get into the tissue. You only have a few hours to release the pressure, let that tissue expand and the pressure go down before the tissue or muscles start to die and additional permanent damage happens. And that's a surgical emergency.
My patients who have these injuries, who are not elite athletes, I tell them, we're going to do everything we can to get the bone to heal, to avoid complications, and to get you back to function as best we can. But unfortunately, the nature of this injury is such that it is truly a life-altering injury. And personally, being a very big Tiger Woods fan, I would say, unfortunately, it's very, very unlikely that he returns to be a professional golfer after these injuries. It really would be difficult for any golfer, but as you said, his age, his multiple back issues, this is going to be a very long road ahead if he chooses to attempt to return to his previous level of golfing.